phalanxes, right? Phalanges, plural. Phalanx is singular. And they're individually named. Proximal, distal, middle, right? All right, A is in the navicular bone. And B is in the lunate bone. So these are actually kind of easy stations, the hand and foot. Although you may say, oh, they're hard, they're twisted, they're not right. I hear this crap all the time, right? Get over it. Learn them. And the best way to learn them, of course, is to do the process of elimination. So if you sit here quietly, you can eliminate the pisiform. It's too small, that's small. Eliminate the hamate, because it's got a handle. Eliminate the capitate, that's the large one. Eliminate the trapezium, that goes to the thumb. And the trapezoid to the butterfinger, not the butter, the index finger. The scaphoid, and then the triangular, which looks like nothing. And then you can see the moon, so it's the lunate, right? So use the process of elimination, that's the best way. If you know them all, it's a game. If you just memorize a few and you're going to try to guess at it, well, we're going to have a lot of fun. I'm not, because on your test I'm going to be scratching everything out. Station number 5. A is the styloid process of the temporal bone. Styloid process of the temporal bone. And B is the transverse process of T2. T2. Might be T1, might be T3, but I say T2, that gives me 1, 2, and 3, right? Because I'll take it one bone either way within the section. Now here's a tough one. Got to read the question. Identify the bone immediately anatomically lateral to this bone. Well, that's your scapula, right? This goes on this shoulder. Humerus bone without an O. Right? Nothing funny. Put an O in there, and ain't nothing humorous. The pin is sticking in the spine of the scapular bone, right? Should I ask you to identify the structure, right? This one, identify the bone immediately inferior. Well, you got to mentally flip that sucker over, right? And inferior is this bone right here, which is the palatine bone. Got it? But if I was asking you to identify the bone or the structure, it would be the vomer bone. Right? The perpendicular plate of the vomer. All right, station number 7. This is pretty easy, right? You got it? Identify the joint at the tip of the pointer. It's sitting on the manubrium of the sternum, right? And this joint is the sternoclavicular joint. Right? Sternoclavicular joint. And this joint, B, TMJ, right? Temporomandibular joint. And station number 9 or 8, call it what you wish. Identify the structure at the tip of the pointer. It's sitting in the radial notch of the ulnar bone. What's this little point right here? Styloid process of the ulnar bone. Those are my favorites. How about this? Obliquenon process of the ulnar. See? Identify structure B. The anterior fontanelle. That one I'll have you spell out. Right? Put a little F up there for you. All right, got those?
Can you go over 8 and D again? 8.
Right here, the radial notch. That's where the head of the radius fits and rotates, right?
You call it the radio owner notch?
I'll accept that.
Okay, but that's, all right. Radio owner notch, all right.
You're just adding more to right.
Well,
Misspell
no,
it.
that's how I learned it, so.
You might misspell it there, and then I'll got you.
All right.
All right, muscles and tendons and all these other kind of things. Station 1. A is in the latissimus dorsi muscle. It's a huge muscle. That's the wing when you work out. You get that big triangular look. Those are lats, right? B. Oh, well, that's so easy. Longest muscle in your body, the sartorius. I'm sorry I asked that. It's just too damn easy. Right? Don't expect it on the test.
Not easy.
Come on, too easy.
That ain't easy. It's the hardest.
I expect to put a little more pressure on you than that. All right. This muscle here labeled A is the obturator internus muscle. If you look on the inside, it's huge. That's it all over here. Goes through the obturator foramen and comes out as the central muscle. The two muscles surrounding it, bookending it. One on top is the superior gemellus muscle, and the one below is the inferior gemellus muscle. One muscle up is the piriformis. One muscle down is the quadratus femoris. One more muscle up is the gluteus medius muscle. Right? So I expect you to know all those in your buttocks, right? I seldom ever ask the gluteus maximus, too easy, right? But I always tell students, do not inject in the gluteus maximus, because underneath it is this giant nerve. You see this big yellow stripe? That's a nerve. But that's not real. This is an artistic impression of that nerve. The real nerve on this guy would be the size of my thumb. So on a real person, it's actually bigger and flatter. So it's huge. They've made it real skinny on this model, so you can see the muscles underneath it. So in real life, that nerve's like this big. So if you inject into the gluteus medius, your chances of hitting it are huge. And if you hit it and tear it, or inject a chemical that is astringent or acidic on that nerve, you can kill it. Or kill part of it, and that causes sciatica. And that person will have pain shooting down their leg, or numbness for the rest of their lives. And they'll hate your ass, so don't do it, right?